National Paediatric Hospital Development Board was appointed by the Minister in 2013 to design, build and equip the new Children's Hospital on a campus shared with St James's Hospital in Dublin 8, a paediatric outpatient and urgent care centre at Conway Hospital, and a paediatric outpatient and emergency care centre at Tala Hospital. Both satellite centres were handed over to CHI in 2019 and 2021 respectively, and are now fully operational. BAM were instructed to proceed with the Phase B above ground works on the new Children's Hospital in January of 2019. In February 24, the Government approved enhanced capital and budget sanctions, bringing the total approved capital budget to 1.88 billion for the NPHDB component of this important project. The revised Government-approved increase included provisions to address areas not originally included within the 2018 budget, a number of which were clearly set out in the independent review carried out by PwC in 2019. The PwC report, which noted that the Children's Hospital was unique in scope, scale and complexity, also noted the number of project risks that had the potential to place further cost pressures on the approved capital budget. These risks included contractor entitlements under the contract, the outturn of provisional sums, recovery of construction inflation above 4%, the need for additional capacity and capability in the executive team of the NPHDB, changes in healthcare policy and regulations, and the contractor's right to claim for additional true costs in line with public works contract provisions. Project costs, like other areas of the construction sector and wider society, have been impacted by external pressures, including impacts to supply chains arising from the pandemic and other global events such as the war in Ukraine and Brexit. The NPHDB addressed all of these risks and previously unidentified costs in its engagement and discussions with stakeholders ahead of the approval of the capital increase, and believes that the enhanced budget of 1.88 billion reflects the additional requirements at the appropriate level. As at the end of August 2024, the total amount spent on the project by the NPHDB is 1.478 billion, including VAT. Regarding progress to date, you will have seen from the images and the information pack that we provided, construction on the NCH is approaching its final stages. The main focus relates to bringing all the rooms and spaces within the hospital to the completion standard required by the contract. In addition, the technical commissioning is being undertaken and will continue until substantial completion. This work stream is approximately 40% complete. The external works include the main entrances, road junctions, emergency department, car park, upgrades to the St James's campus internal roads, hard and soft landscaping, gardens and play areas. The connecting paths to the St James's Adult Hospital are well advanced, with outstanding elements such as the new CHI St James's ambulance yard and canopy programmed to be complete by Q4 2024. The specialist clinical equipment built into the hospital, such as the MRIs, the CTs, X-rays, C-arms, AGVs, etc., are all installed and are currently being commissioned. In 2024, the NPHDB will complete its procurement of the medical and non-medical equipment to be installed post-substantial completion. Almost 66 million of clinical equipment has already been procured. The most advanced and contemporary equipment is being procured for the hospital. Where equipment is required to interface with the CHI's electronic healthcare record, that is being developed by CHI, and this has been delivered to CHI for validation and testing. The construction of the helipad is complete, and test flights will take place towards the end of 24 and continue into early 25. The NPHDB procured ClearSphere as its contractor to undertake 4 specialist fit-outs within the NCH, comprising the pharmacy, the radiopharmacy aseptic compounding units, the stem cell laboratory and the biosafety laboratory. These specialist fit-outs commenced in September 24 and are due for completion in Q1 2025. In February 2024, construction on the new Ronald MacDonald House, which is located across from the main entrance of the new Children's Hospital, commenced. Clancy Construction Limited was appointed to design and build this facility, which will provide accommodation for 52 families each night, more than double the accommodation currently available at the Ronald McDonald House in Crumlin. The new facility is 30% complete, on budget, and due to complete in Q3 of 2025. In the last 4 years, the main contractor, BAM, has shifted its substantial completion date 14 times. In the last 12 months alone, BAM has shifted the substantial completion date 4 times, pushing out the completion date by a total of 8 months. BAM is currently communicating June 2025 as its anticipated substantial completion date. In the absence of a written, contractually compliant, realistic and resource-loaded programme, the NPHDB cannot and will not simply accept BAM's ongoing deferral dates. The employer's representative, who is the independent contract administrator, has not accepted this latest update and has requested that BAM submit a revised baseline programme in accordance with the requirements in the contract. A baseline programme is a critical requirement fundamental to any construction project, as it provides a clear approach and timeline for works underway up to substantial completion, allowing for work to happen in an efficient and effective manner. The absence of a baseline programme on any construction project, especially one of the scale of the new Children's Hospital, is completely unacceptable. BAM's continued failure to provide a compliant baseline programme and its shifting of dates is not acceptable to the NPHDB nor to our colleagues in CHI. It shows a complete disregard for internationally recognised professional processes and contractual procedures. The approach being taken by BAM also shows complete disregard for the sick children and young people and their families, as well as the dedicated staff in CHI. It is clear to the NPHDB that the biggest factors contributing to the continued delay are BAM's continued insistence on offering rooms and areas within the hospital as complete when they are still incomplete, BAM's continued failure to manage the project execution, and BAM's continued unwillingness to resource the project appropriately. This is why BAM is consistently failing to deliver on its planned commitments month on month. BAM's most recent forecast completion date is June 25. This is 31 months behind the current contractual completion date of November 22 and 4 months later than the substantial completion date the NPHDB provided to the PAC in May of 2024. In the contract programme provided by BAM in January 2019, BAM committed to a peak resource of over 1,700 productive operatives. The highest level of resources provided by BAM to date was in June 22 with circa 1,260 productive resources. In 2024, there's been an average of 774 productive operatives on site. This dropped to 612 in August and was 631 in the first 2 weeks of September, which is unacceptable. BAM has failed to resource this project sufficiently. This is evidenced by their continued failure to meet their own planned progress, the low monthly valuations, and the continual shifting of the completion date. Since last September 23, BAM has, on average, achieved 64% of its planned progress. As of today, not one room has been fully completed in line with the standard and finish as set out in the contract. There are 5,678 clinical spaces in the new hospital, and whilst to date BAM has offered 3,128 as complete, none were completed to the required standard. All rooms offered by BAM require additional work prior to our team being in a position to sign them off as complete. BAM persists in offering sections of the hospital for review and sign-off when they are very obviously incomplete. BAM is currently abdicating its contractual responsibilities with regard to its quality management plan, its fit-out plan, and its final room inspection plan. BAM contractually undertook to deliver a building that is completed to the standard expected and with all snags addressed. The state is paying for a high-standard building, complete to the level designed, and I assure you that we will not accept anything less. In order to ensure that the handover process is appropriately managed and completed, the NPHDB has had to assign additional resources to this handover process, and we are holding BAM to account on its processes. Given BAM's reputation in the market as Tier 1 contractor, the NPHDB find BAM's continued failure and refusal to comply with its obligations under the contract to be completely unacceptable. The manner in which BAM has progressed the works towards substantial completion is, and always has been, completely unacceptable to the NPHDB. The outcome being a loss of benefit to the state and, importantly, to sick children and their families due to the delay in substantial completion of Ireland's new Children's Hospital. The NPHDB has continued to do everything in its power to compel BAM to conclude its works and to fulfil its contractual responsibilities. BAM is not fulfilling its contractual obligations, and consequently we have moved to withhold 15% of certified payments due to BAM. This is a lever available to the NPHDB within the contract, and we have initiated this yet again. The NPHDB previously withheld 15% of monies due to BAM between the period of May 2020 and February 21, when the BAM programme was deemed by the ER to be non-compliant. The NPHDB also threatened to withhold 15% in 2023. This was not actioned, as BAM did provide a baseline programme. Meanwhile, BAM continues to submit large volumes of claims, including duplication and triplication of the claimed time and value. It is the view of the NPHDB that BAM is seeking to implement a strategy to exert pressure on the state to secure additional monies above the contract sum by whatever means. The NPHDB is robustly defending claims that it considers to be without merit or to be inflated, to prevent cost escalation and to protect the public purse. Regardless of how many times BAM asks, BAM will not be given another cent beyond what it is entitled to under the contract. Where there have been changes instructed by the NPHDB, and it's not unusual on a project of this nature or any project that there would be changes instructed, we pay BAM for additional resources and their supervision to minimise the impact on the programme. We continue to do everything in our power to compel BAM to conclude its work and to fulfil its contractual responsibilities, including notifying the NPHDB's intention to apply liquidated damages for late completion. I very much regret to have to report today that BAM is continuing to fail in its contractual obligations. It is a source of frustration, concern and anger that we are dealing with the issues that have been set out. I want to assure you that the NPHDB has not left any stone unturned or any legal route unexplored in our efforts to seek to influence and indeed compel BAM to meet its contractual obligations. But to date, the efforts have yielded limited return. The approach by BAM to this project is unacceptable, and we continue to do all in our power to ensure that the hospital is delivered to the standard required as soon as possible. Thank you, Chairman.